My patient rang his call bell. He said that he needs to use the BedPan. I've washed my hands before entering the room. I enter the room and I ensure privacy by shutting the door behind me. I understand you need to use the BedPan, and I'm going to help you with that. Can you tolerate laying flat? He tells me that he can, because I'm going to need him to roll over to his side, and it's easier on their back if you have them laying flat first. I'll lower the head of the bed. You tell me if at any time you're not comfortable, okay? All right. I'll put on my clean gloves. And I'll raise the bed to a comfortable working height for myself, so I'm not bending over. I'll lower the side rail so it's not in my way and I'm not leaning over it. There are two different types of BedPans. One is a fracture pan, and this is for patients who have sustained some sort of injury to their back and they're not able to have something that's this tall underneath them. It causes them either too much discomfort or it's a safety issue. I'm going to lower your blankets, all right? And I'm going to lower them a little bit more than I probably would need to, so that you can see clearly what it is that I'm doing. And I'll raise your gown so it doesn't get soiled. Now I'm going to ask you to roll over to your left side. If your patient's not able to roll themselves, you can grab the draw sheet underneath and hold it correctly using good body mechanics so that you don't hurt your back. And have your hands in this position so that you can use your bicep strength to turn the patient rather than the elbows. You can cause tendonitis in the elbow if you're turning them that way. 1, 2, 3. Excellent. Now some institutions, they'll put down a blue absorbent pad that's disposable prior to putting the BedPan under in case some urine or feces were to spill. Here I've got a pad that is laundered, so that's what I'll use at this institution. Now to get it under my patient without pulling his skin, I push down on the bed and slide it under the patient, and I make sure that it's centered well. Okay, you can roll back onto the BedPan. Assist your patient to roll back so that it's centered. Raise the head of their bed so that they're sitting comfortably, sort of as they would on a toilet. I'll remove my gloves the proper way and dispose of them and cover my patient so that he's got some privacy while using the BedPan. Make sure that you lower the bed to its lowest position and give the patient either some toilet tissue or wipes in case they need to wipe themselves before you're able to return. Make sure they have their call bell so that they can call you. I would then wash my hands and wait for him to ring his call bell that he's ready to get off the BedPan. I don't want to leave him on there too long because that can cause tissue breakdown. So if he doesn't ring his call bell within a few minutes, I'll come back and check on him. The patient rang the call bell and said that he was finished. I washed my hands before entering his room, and as I entered, I shut the door behind me so that I provide him privacy. I'll raise the bed to a position of comfort for myself. And I'm going to lower your head slightly. I don't want to lower his head all the way down because then the BedPan might spill, but I want to lower it slightly so that when he goes to turn to his side, it's not so uncomfortable for his back. Okay, I'll put on my gloves, and I brought some wipes. I'm going to pull your covers down. Okay, I'd like you to roll onto your left side, okay? If they need your assistance, you can help them. As he's turning, I need to keep a firm hold of the BedPan. Otherwise, as he turns, the BedPan will flip to its side and dump all its contents all over the bed. I have a firm hold of the BedPan. As he turns, the BedPan is not turning with him. I'll wipe the perineal area front to back first. And now I'll wash the anal area. Now I'll remove the bedpan, remove my gloves, dispose of those, and assist my patient back to a comfortable position. Cover him back up. Put his head at a comfortable position for him, and then lower the bed all the way down to the floor. Now I'll need to don another pair of clean gloves in order to pick up the bedpan and take it into the bathroom. I'm careful if there are wipes in there that can't be flushed that I remove them before dumping the contents into the toilet. If my patient is on I&Os, or intake and output measurements, I'll be sure to measure the contents before disposing of it in the toilet. I'll then clean the bedpan using the toilet sprayer and leave the bedpan in the bathroom. My final step is to wash my hands, and again, if my patient is on I&Os, intake and output measurements, that I'll log that into his chart or into the computer.